Pharmacare has certainly been always on the radar of Canadian Doctors for Medicare because as physicians we're well aware of a couple of things. One is that pharmacy and the expenses of pharmaceuticals is by far the fastest growing part of the healthcare system. And secondly, if patients need medications and can't afford them and therefore don't take them, it actually costs the healthcare system even more. And so finding the balance where, like their medical care, the pharmaceuticals that patients get are based on what they need, not on what they can afford, we're all going to be better off. When I was 9 years old, I spent months in hospital with polio. And if there was not hospitalization payments at that time, my parents would have lost the farm that my brother still occupies. It's my great-grandmother's homestead. That's a bit of a metaphor for how, when we care for one another, we allow people to grow into what they can be. And there's a direct analogy to that with Pharmacare. Nowadays, people can go into hospital, and that's a challenge in itself. The interesting thing is that now we feel we can't afford that when they get out of hospital, they can get the care and medication that they need to keep them from going back into hospital. And that's the main focus of why Canadian Doctors for Medicare wants to move forward. My parents' generation had a tiny fraction of the per capita resources that we have, but they built the universities, they built the hospitals, they cared for one another in a way that allowed them to keep their farm, to keep their businesses. And we need to ensure that in our generation, with incomparably more wealth, we also don't escape our responsibilities by pretending that we can't afford it.